All right, so we're doing eyes and ears, sensory neural nursing. All right, so first is eyes, is a hard one, and then we'll move on to hearing. Okay, so eye disorders. So eye disorders will include ones you have to know are your refractory disorders. So these are being nearsighted or farsighted, and also with age, your vision goes away, just like your hearing. And the Latin word for old is presby, all right? So presbyopia, and then presbycusis is old age hearing, or loss of hearing with age. There's loss of sight with age, right? Or problems with sight at least. All right, so we'll talk about myopia, hyperopia, and hyperopia and presbyopia are almost the same thing, just a different mechanism. All right, and we'll talk about astigmatisms as well. These are all refractory disorders where the light comes into your eyeball and it does not hit the goal target, right? And it's literally a target. It's the macula at the back of the eye, right here, right? So light enters and it should hit the back of the eye, and then your brain, it actually hits your eye upside down and backwards, and from the left side and right side, half the vision goes to each eyeball, and then it goes away into the brain, back into the occipital lobe. First, take a little rest stop at the temporal lobes. All right. So we're not really worried about the brain parts. Or you learn about brain parts in Med-Surg 1 when you had like a stroke to the temporal lobe, you lost half your vision on one side, right? Here we're just talking about errors with the eyeballs themselves. All right, so we talk about refractory disorders, again, where the light's coming in. So light's coming in, and then it should hit the back of the eye, right? That's actually called, normal vision is called emetropia or emetropia, right? And then if it doesn't hit the back of the eye, meaning that it goes in front of the target, or it goes behind the target, right? It's going to be out of focus, right? When you have to pull out your phone, you just hit the screen, and then it focuses, right? That's called accommodation. When you hit your screen, and then it comes into focus, right? But really, our eyeballs have to do all kinds of fancy tricks to move things around and accommodate the image and bring it into focus. So it's blurry if it's right there. It's blurry if it's right there. So we have to change some things. We can't change the cornea, right? You don't have muscles that change your cornea shape, right? That's what's going on with these refractory disorders usually, is the cornea is misshapen. It's either too pointy or too flat, or it's bumpy all over. The bumpy all over one is the astigmatism. And that light it should nicely come in, but then it's going to not hit its target, right? So we'll talk about different reasons, causes, symptoms, etc. for these. The nice thing about symptoms is they're all the same for refractory disorders. For the refractory disorders right here, the symptoms are just headache, nausea, and vomiting, right? That's all you got as the common symptom between all three of the 3 or 4 of the refractory disorders, right? When we talk about cataracts and retinal detachment and glaucoma and MD or macular degeneration, then they're going to have some other symptoms on top of them, right? Where the vision, the peripheral vision goes away, or one where the central vision goes away, meaning that on the test you're going to have a picture and have to identify, oh, the central vision's gone. What is that disorder, right? Or the peripheral vision's gone, right? Or it's in sepia tones. Someone put an Instagram filter on it, right? That is one of our disorders, cataracts, by the way. Okay, so when light hits a glass surface, it will change the shape, right? It will get refracted. It will get changed, right? And we have to introduce our knowledge of a little bit of physics about convex and concave shapes, right? So what's a convex shape? A convex shape is this, right? Convex is where it looks like a lens. It's literally it's a lens, right? Its convex shape is where it is outward, right? It's a bulbous shape. It has a bulb to it. Whereas a concave shape looks like what? It has a cave in it, right? So it looks like this, right? So this is an example of a concave lens, because your eyeball cannot suck into itself and make itself concave. It can make itself less convex, which we'll talk about, which is a little bit confusing, but you imagine what happens when it's usually convex, and then what happens if you are less convex, right? But obviously the treatment for these is to get glasses or contacts, or replace the lens, or replace the cornea with surgery. and we are going to either flatten it down, or with the lenses, we can introduce concave apparatuses, right? But usually what we do normally is we can make our lens fatter, or we can make it flatter, right? So fatter or flatter, or more convex being fatter, right? And less convex being thinner or flattened, right? Does that make sense? So we'll talk about each one of these separately. Okay, so visual acuity disorders. So refraction, that's just the light entering the eyeball, and we want to make it in focus. And how do you make it in focus? It needs to arrive directly where? Directly on the end of the, on the macula, on the retina, right? It needs to land on the retina right here, right? That's perfect. So once it lands on the retina, it's in focus. If it arrives here, it's out of focus. If it arrives here, past the retina, it's out of focus, right? So we have two refractive disorders, one that brings it too close and one that where it's too far, right? So we'll talk about each one of those, right? So 1/3 of those who age over 40, or those over 40, 33% of them are going to develop old age eyes or presbyopia. So we'll talk about that. That's a dysfunction of the lens. So we'll get to the lens last. First, we're going to talk about problems with the cornea, right? So where's your cornea at again? Where's your eyeball's cornea? It's the outermost structure of your eyeball, right? It's this shape right here, right? Just on the outside. That is the cornea. Okay, so that cornea can be misshapen, right? It can be too pointy or it can be too flat, right? The other thing that can happen is your eyeball itself can be too short, too squished, or too long, which would make the image be outside of where it needs to be. So in this case, you see the eyeball is too short, right? And now the image has passed the retina, its target. Okay, so that's a different situation that could happen too. All right, so kids usually have smaller eyeballs, right, compared to when they get older. Also, you know, there's different skull shapes, all these different things that could cause, and like squinting be a reason why our eyeballs might get longer than usual. Okay, so refractory errors occur due to inability to bend the light rays, so by the cornea or the lens, right? When we talk about presbyopia, that's the lens. Everything else is cornea problems, right? Astigmatism is a cornea problem. Hyperopia and myopia are cornea problems, right? Where the cornea is too pointy, which is convex or concave. If it's extra pointy, it has increased convexity. It is increased convex, right? So that's this down here, right? So convex. All right, so you have to understand what happens when you throw a light ray at a convex shape, right? So if you have a convex lens here, light comes in, right? And it's going to get narrow, just like a magnifying glass, right? If it is too convex, the image is going to then come closer, right? So increased convexity causes convergence of the image. The image gets closer to the lens, okay? So for instance, if we draw this guy right here, if we make our lens more convex, right? The light rays are coming in, the object is emitting light, whether it be a candle, a building in the distance, or whatever. It's going to come into the eyeball, right? It's going to be focused, and then the lens is going to focus it more, right? And then if we are too convex, that image is going to converge closer to the lens, right? So the only thing we can do now is change the lens shape, right? We can't change our cornea shape, right? So our lens can accommodate to bring the image into focus. So if we do want the lens to get fatter, if we make the lens fatter, the image will get even closer, right? So we want the lens to what? To flatten out, right? If increased convexity makes the image get closer to the lens, if we make it decrease convexity, because we can't make it concave, that's how we fix it. We put some glasses on them, right? But we make the lens what? Flatter or fatter? Make it flatter. If you make the lens flatter, right? Make our lens a little flat. Oh, that doesn't show up at all. We make our lens, you know, from a normal shape to a thinner shape, right? Make it really super thin. That doesn't look like good at all. Let's erase that, right? We make the lens tighter, flatter, thinner, right? Lost weight, right? It's going to make the image hopefully arrive at the spot it's destined to, which is what spot? It's the macula of the retina. The macula is the central part. It's the part that has the most rods and cones, has the most photoreceptors to be able to take in an image, right? So that's the idea here. We got to make the lens fatter or thinner. That's all we can do because our cornea is messed up, right? We could throw some glasses on them because look what a concave glass does, right? A concave makes the image go outward, whereas convex always makes the image go inward. And if it's increasingly convex, if it's fatter, the image is going to get even closer to that convex lens, right? Or cornea, whatever it may be. Okay? So how do you make things fatter or thinner? How do you make that lens fatter or thinner? That's where we have the ciliary muscles, right? So ciliary muscles are what squish the lens or flatten it out, right? So where's our lens at? It's this guy right here, right? And we have little ciliary muscles on the side over here, the little X shapes, right? So those ciliary muscles will thin it out, or they'll make it fatter, right? So we can adjust the image shape, wherever the image is at in the eyeball, we can change it based on the lens shape, right? And we do that, we accommodate, right? When something's out of focus, your lens will automatically maybe let in more light, or more commonly to focus the image, you're going to change the lens shape. So your ciliary muscles are radial shaped, right? They are sphincters, all right? If you want to close a sphincter, what happens? The sphincter gets tighter, right? And things get squished out, right? If you think of a poop, right? You're going to squeeze out a poop. Your sphincter is closing, right? Versus if you open your sphincter, right? Well, I guess poop comes out too. It's a bad example. So if you open your sphincter, you're relaxing things, right? And things are going to get wider. Okay. So when your ciliary muscles relax, the lens gets wider, it gets flatter, it gets less or more convex. It gets less convex. Does the image get closer to the lens or farther from the lens? In that case, if you're getting a flatter lens, a less convex lens, the image is getting farther or closer to the lens. Yeah, less convex. That's 10 seconds ago, but it's cool. So yeah, so less convex. All right, so our lens is getting thinner, right? Because our ciliary muscles are relaxing. They're stretching out that lens, right? You're like, well, how does the lens even stay there? There's actually little strings attached to it, and when it relaxes, when the muscle relaxes, when that sphincter relaxes, it kind of pulls the thing in the middle tight, right, taut, and it will make that a less or more convex. Do we say? This makes it less convex, right? If you make it less convex, the image gets closer or farther away from the lens. It gets further away, right? Because if you made it fatter, right? If you made our image fatter right here, the image would get closer to the lens, right? So for instance, right here at the bottom, we have a lens that is fatter and we have a lens that is thinner, right? So if the image was right here, let's just put it in green, let's say red maybe, right? Here's our original image, right? And then now we want to bring that image into focus, right? We want to bring it onto our retina. If we bring it too close to the retina or too far away from the retina, right? For right here, look, it's too far away, right? And here is too close, right? It's astigmatism, but let me just do the right one. Well, we'll go into each one of them, but you can see right here the image is too far away, or too close right there, right? And too far away right there. So our lens needs to accommodate. It needs to bring that image closer or farther away from itself, right? So in this case, if the lens gets thinner, like we're talking about, what happens? The image is going to get closer. Sorry, I heard closer, and that's not correct. All right. So the image is going to get. So remember, if you make something more convex, let's just start there first. If you make something more convex, the image gets closer to the lens, right? All right. Someone has really heavy glasses, right? Really thick glasses, bottle. What do they call them? Bottle cap, bottle lenses. What do they say? Coke bottle lenses, right? Those are really, really convex, right? They could be really, really concave too, but they're really concave. The image is going to go right up close to that lens, right? Versus if they make that a little bit thinner, the image is going to go farther away. So if we make our lens fatter, right, this is going to bring it closer to that lens, right? Versus if we make our image, if we make our lens thinner, that's going to make our image go farther away, right? Closer to the retina. Okay, so again, ciliary muscles contract. When sphincters contract, they push things out. So they push and squeeze the lens and they make the lens fatter, right? So when our ciliary muscle contracts, it makes our lens more or less convex. What's it doing? Makes it more convex, right? More convex. And that then makes the image closer or farther away from that lens. Makes it closer to that lens, right? So it makes it nearer to the lens, close to the lens. It converges on the lens. So the convex converges. It brings the lens in. It brings the image closer to where you want it to be, right? And when ciliary muscles relax, right? They unsqueeze. They relax. They dilate out, right? They dilate out, but there's strings attached, and their strings are attached, and they make that lens thinner, right? And that brings the image where? Closer or farther away from the lens? Brings it farther away from the lens, right? It's going to get flatter, right? It's not going to do as much work. It's going to not bring it closer, because when the lens gets fatter, more convex, the image gets closer, right? If you have a magnifying glass and you make it have more magnification, it will. If you have a thicker magnifying glass, it looks closer, right? Yes. Correct. I have to explain it as like a sphincter, because it doesn't make sense. Like, well, if the muscle contracts, I imagine it's going to do, make it, it's going to get tighter, right? Or make it thinner or fatter. You have to think of it as a sphincter, right? Whatever your favorite sphincter is, right? You can use that. Okay. So you're going to squeeze things out, right? So it's going to squeeze the lens and make it fatter. Okay. So that's what the ciliary muscles do. They are what are responsible for hopefully bringing things into focus. But if your corneas are way too messed up, guess what you need? You need some extra support. You need some glasses. You need some corrective lenses, right, to really help the situation out. Okay, so we can do that. We can put contact lenses. We can put or we can put glasses on them, right? And that will help it out, because if the lens did all it can, right? For instance, we made our lens super, super fat to bring that in, because the image was way behind our retina, right? It was way back here. Let's see a good one. Yeah, this one, right? Why can't I visualize this? All right, so it's back here, right? Let's put it in blue maybe. It's like way back here because our eyeball is way too squished, all right? Our lens is way too messed up. Our cornea is way too messed up, and our lens did all it could to squeeze down, because our muscles contracted and squeezed, right? Squeezed it out, and to squeeze the lens, make it more convex as possible, and then it couldn't operate, right? It couldn't bring it into focus still. So you need to throw some glasses on them, and our glasses are going to have even more convexity to it, right? So our glasses are going to have a little bit more convexness to it. Okay, so that's the idea. Okay, so where are we going to go with that? So when lens is cloudy, right, that's cataracts. So we'll talk about cataracts after we talk about refractive disorders, because you could be focused as much as you want, but what if your lens doesn't work? It could be, the image could be in focus, but your screen itself on your camera is dirty, right? There's something on the lens itself. The lens becomes cloudy. Okay. And that happens usually with aging. It's common with aging, and diabetes will accelerate that process. Okay, and then astigmatism is just where your lens is not just convex or just just increased convexity or just decreased convexity. It's in different areas throughout the whole cornea, and we'll talk about that, right? And in that case, you can't really, you can change your lens shape all you want, but the top quadrant of your cornea is too convex, and the bottom left quadrant of your cornea is less convex. So that's not in focus, right? So all these can be hereditary. And again, normal vision is emmetropia. That's just where you have normal vision, where you're able to accommodate without any corrective lenses. Okay? So lenses, all they can do is what? They can get more convex or less convex. They cannot what? They cannot concave. That's not something you have to now introduce glasses to make that happen. Okay? So important structures, the macula. What's the macula for again? When the image is there, it is in focus. That is where the most concentration of photoreceptors are. That's where you're going to absorb the image, right? And that macula can degenerate, and that's called macular degeneration, which is one of our disorders, right? And we have the ciliary body, which is a what kind of muscle? It's a sphincter, right? And it's a sphincter, and when it contracts, what happens? When it contracts, it squeezes the lens, right? A sphincter contracts, it squeezes out whatever's there, and they have a lens there. It's going to make that lens fatter and more convex and bring the image closer or farther away from it. It's going to bring that image closer to it. If you imagine like a magnifying glass again, right? And you have a magnifying glass that's extra round, right? Extra convex. It's going to bring that image closer to it, right? Versus a magnifying glass that is just a glass, for instance, right? Like just imagine just like a magnifying glass is just like, is very, very thin, right? That image is going to be just where it's at, basically. It's not going to get closer to you at all, okay? And then other important things are the lens itself, which you talked about, and the cornea, which we're talking about next, different cornea disorders.